It's 8, Shilpi. Sai, can we go live?
We are
Sai,
live, Doctor.
yeah. Shilpi, you can share the screen. So, good evening, friends, and welcome to the Brain Teasers, which is presenting in association with Ophthalmological Society of Nagpur, the Pan India Intercollegiate PG quiz, that is the Big Q in its season 3. Next. So, this is the signature tune for our online live here.
आठ
And the Big Q
समंदर
is an
अपना
offshoot.
अंबर
सारा कुछ
खोज
इतना
ले
ही
अब
है।
तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर खोल पर खोल पर आठ समंदर अपना
So good evening, friends, and we welcome you all to the fourth quarterfinal of this third season of Big Q. This is the third season of Big Q. This season had 8 preliminary rounds. This is the fourth quarterfinals. Following this, we are going to have 2 semi-finals and 1 finals. The episode is being displayed on alternate Wednesdays at 8 p.m. So we will be having the first quarterfinal after 2 weeks on the same day, that is Wednesday at 8 p.m. again. Brain Teaser is extremely thankful to the team of quiz masters who toil hard to create a wonderful experience of learning with fun. For today's episode, we welcome Dr. Himadri Chaudhary, who is a consultant retina and vitreous surgeon at Chaudhary Eye Hospital and Research Center, Silchar, Assam. The second quiz master, again, she's from our old batch of Brain Teasers quiz masters. She's an assistant professor at All India Institute of Medical Sciences at Rajkot. And again, the old warhorse, that is Professor Dr. Arvind Maurya, who is an additional professor and head cataract, glaucoma, refractive squint, pediatric ophthalmology, and medical retina services at All India Institute of Medical Sciences at Hyderabad. As we are all aware, such mega projects are not possible without a strong financial support. And Microvision has been our steadfast partner for last 3 seasons. Our sincere most gratitude goes to Mr. Ashok, Mr. Kumaran, Mr. Navneet, and all the field force who have made this quiz a mega success. Mr. Sai and his Numerotech team is responsible for flawless execution of the quiz, computing the results, and other back-end work which goes behind every episode's smooth, seamless beginning. So thank you, Sai and Numerotech team for that. So before much, let me thank once more Dr. Shilpi, who is the co-host of mine and now the main host, rather I should say, because in my busy schedule, she takes over of most of the back-end work as well as the front-end work of our Big Q. So over to you, Shilpi.
Yeah. Thank you, sir. So good evening, friends. Welcome to the quarterfinal 4 of Big Q season 3. So this is the promo from our sponsors, that is the Microvision team. So now let's quickly see what is the format. So today is the fourth quarterfinal. In these four quarterfinals, 80 teams have participated, 20 teams per quarterfinal. So our first semi-final will be on the 8th of May, that is Wednesday at 8 p.m. So for teams, you have to log in through Kahoot and Zoom platform, and you need to log in from two devices, but one email ID. The first screen is a live quizzing screen for the Zoom platform for a rapid fire round. That will be the face-to-face round only for the teams. And the second screen is the Kahoot for MCQ round, which will be played by both the audience and the teams. Mentors to log in only on the Zoom platform from a separate screen. So 5 out of 20 teams from each quarterfinal will qualify for the semi-finals. After this quarterfinal, we will declare the results which teams have qualified for the semi-finals. So what is the criteria for qualifying for semi-finals? It is the respective marks of your quarterfinal plus the total of the best 5 preliminary rounds marks. Now, what are the rules? MCQ, each set will have 5 questions, which will be played by both the teams and the audience. There will be no negative marking in the MCQ round. While the rapid fire round, it is only for the teams in the Zoom on the Zoom platform. You have to answer 5 questions maximum in the 30 seconds time. So you will have 30 seconds and you need to answer 5 questions. So if you don't know the answer, say pass. If the time is left, you can attempt that question later on. For every correct response, you will get plus 10, while for the incorrect answer, 5 marks will be deducted. So teams which are not playing today's quarterfinal, they can play as an individual in the private practitioner category. So these are the prizes for the 6 teams in the finals. And these are the audience prizes which are per episode. So for this episode, these 3 prizes will be given to the private practitioners or the ophthalmologists who are playing in the private practitioner category. So now let's refresh our Kahoot platform and see whether it is working properly or not. So this is a sample question for today. Which mission team has been presented with the prestigious 2024 John L. Jack Swigert Jr. Award for Space Exploration? Your options are A. Chandrayaan 2, B. Chandrayaan 3, C. Aditya L1, and D. Aditya L2. And your time starts now. Yes, time is up. And let's see what is the answer. The correct answer is option B, that is Chandrayaan 3. So with this, I introduce our first quiz master, Dr. Himadri Chaudhary, who has done his fellowship in vitreoretina from LV Prasad Eye Institute, has presented multiple papers, posters, and videos in various zonal, national, and international conferences. He was the part of instruction courses on phaco, diabetic retinopathy, and endophthalmitis at national and state level. He is the trainer in various SSTC programs, faculty at various conferences. He has been awarded with gold medal for the best medical graduate in 2007, first position in MS ophthalmology, KR Datta award for best paper in OSACON 2018, best video award also, and also the K. Venagala Rao award during AIOS APOS 2024. He has more than 10 publications in national and international peer-reviewed journals and is currently working as a vitreoretina consultant at Chaudhary Eye Hospital, Silchar, Assam. Over to you, sir. Himadri, sir.
You are muted, Himadri.
Thank you for the wonderful introduction. At the very outset, I'd like to thank Dr. Prashant for organizing this wonderful PG quiz. It has actually changed how our students look at studies. It has made studying ophthalmology a really interesting and fun-filled affair. So thank you, sir, for this wonderful quiz. So maybe we can move to the quiz now. Right, we'll start with the first question. What pattern does the astigmatic map show? Is it A, butterfly pattern, B, asymmetric bow tie with inferior steepening? Is it C, asymmetric bow tie with superior steepening? Or is it D, symmetric bow tie? Your time starts now. Time up. The answer is B. It's a very straightforward keratoconus. Next slide, please. So asymmetric bow tie with inferior steepening, very classical of keratoconus. Maybe we can move to the next slide. Another straightforward. Please identify this photograph. Is it A, squamous papilloma? Is it B, retention cyst? D, C, pyogenic granuloma? Or D, conjunctival lymphoma? Your time starts now. Time up. The answer is C. Very straightforward. Next slide, please. Pyogenic granuloma. It has a very classic picture. And the treatment is surgical resection with cautery of the underlying bed of conjunctiva. Next slide. Okay, diagnose this condition. Please look at it carefully. Is it A, acanthamoeba keratitis, B, therium keratitis, C, marginal keratitis, or D, ulcus serpens? Your time starts now. Time up. Well, again, very simple. It is ulcus serpens. Next slide. So it's a pneumococcal ulcer. It starts near the center and gradually has a tendency to creep over the cornea in a serpiginous fashion. Hence the name ulcus serpens. It is also associated with hypopyon and violent iridocyclitis. Moving on to the next question. The tonometer which is used in irregular cornea, is it A, Mackay mark tonometer? Is it B, a rebound tonometer? C, Drager's tonometer? Or D, Maklarkov tonometer? Your time starts now. Time up. And the answer, correct answer is A, Mackay mark tonometer. We'll move on to the next question. Okay, bilateral white dot syndrome. Which bilateral white dot syndrome is characterized by acute vision loss that is typically followed by full or near full visual recovery? Is it A, APMPPE, B, birdshot choroiditinopathy, C, MUDES, or D, serpiginous choroiditis? Your time starts now. Time up. The correct answer is A, acute posterior multifocal placoid pigment epitheliopathy. Next slide. So basically, it is a bilateral condition. Rest mostly MUDES is typically unilateral. And serpiginous choroiditis, again, is recurrent inflammatory disease, often vision threatening. But APM-PPE by far has a best prognosis among the rest. Okay, we'll move on to the next quiz master. I would like to introduce Dr. Mamta Singh. She is the Assistant Professor of Ophthalmology from AIIMS Rajkot. has done her fellowship in cornea and refractive surgery, and has won multiple awards. Among them, Best Poster Presentation in Asia Pacific Ocular Imaging Society Meet, Singapore in 2020. Dr. Anjani Kishore Gold Medal for Best Video in Bihar Ophthalmological Society. Dr. Bose Gold Medal Award for Free Paper in 2018. Dr. Ajit Sinha Gold Medal for Best Poster, and has multiple index publications and book chapters. Over to you, Dr. Mamta.
Thank you, Dr. Himadi. Thank you for kind introduction. And again, I'm thankful to Dr. Prashant and Dr. Silpi. So moving on to the rapid fire session now. Can we go to the next slide, please? Yeah. I think we need to bring, yeah.
Team 1 is Team KK.
We all know the rules. Every correct answer will give +10. Every incorrect answer or wrong answer will give -1. You really need to be, really quick. If you don't know, just say pass. And we'll shift to the next question.
Let them introduce. Please introduce yourself, Team 1, and talk about tell us about your mentor as well.
I'm Dr. Akshata, third year resident from RP Center.
I'm Siddhartha Rao, third year. Our mentor is Dr. Rohan Chawla.
Welcome to this quiz, and hope you will just rock it. So shall we start, sir, for the team 1?
Yes, ma'am.
Okay. So for the team 1, rapid fire question number 1, here it goes, and the time starts now. Carbonic anhydrase inhibitors should be used with caution in patients on digoxin. True or false?
True.
Next question, please. It is correct answer. Substantia propria of conjunctiva is derived from?
Mesoderm.
Correct answer again. ABCD classification system of keratoconus includes
Pass.
total how many stages? Pass. Okay, next question, please. Dream study is related to?
Pass.
Next question. Criteria followed to diagnose early neurological field defect?
Anderson criteria.
No, that's wrong. And substantia propria, you said mesoderm. It is actually neuroectoderm mesodyne, not mesoderm. So that will be also wrong. Okay. So here is the answer. First question was right. That is carbonic anhydrase. It increases the hypersensitivity reaction to digoxin. So we need to be cautious. Substantia propria, neural crest mesenchyme. Total 5 stages from 0 to 4 in ABCD classification given by Bellin. Dream study is related to dry eye evaluation and management, and criteria for neurological field defect is RP Mills criteria, not the Anderson, which is mainly for glaucoma. Okay. So shall we move to team 2?
They gave 1 correct, 2 wrong, so it totals to 0.
Yes, ma'am. Yeah.
So next team is Team 2 Eye Wizards RMC.
Unmute yourself and introduce yourself. No, we can't hear you, Team 2. Unmute yourself, please. No, we can't hear you. You are muting yourself now. Haven't you put on your audio when you started? When you joined the Zoom platform? Sai, can you guide her?
Yeah.
Yeah, Eye Wizards, just listen. The technical person, Mr. Sai, will guide you how to get your...
I think you just have to increase your volume. I think you're already joined. Can you speak out? Are you on a headphone or something?
Have they put on their audio for the system while joining the Zoom? Okay, I think what we can do is, Sai, meanwhile, you can help. We will move ahead with Team 3 meanwhile. Okay.
Right, sir.
Team 2, Mr. Sai will contact you in a second. Till then, we move ahead with the Team 3. Team 3, please come on the screen.
Spartans of the South.
Yeah, please introduce yourself.
So, can you see us?
Yes, of course, we can hear
Yes.
you as well.
So, good evening, sir. I am Chinmay.
Good evening, sir. I'm Krutin.
We are from Arvind Eye Hospital, Coimbatore.
All
Good.
set for the quiz?
Yes, ma'am. Yes.
Shall I go ahead, sir?
Yeah, I think it's a rare species nowadays. The males are a rare species in this ophthalmology quiz and everywhere.
So you want me to help them or what?
Please.
Yes. Okay, Shilpi, let's move the slide. Let's see how do the do. So the first question for you, intraretinal hemorrhage is a known side effect of systemic therapy with interferon alpha. Next question. Glands of Wolfering are located in the most common complication associated with LASIK in diabetic patients. Next question. Term minimally invasive glaucoma surgery was
Glaucoma Association of Texas, Dr. Grover.
No, sorry, wrong answer. Lazoka study is related to. Okay.
First one you want to answer true.
Sorry.
First one you answer true. True. We want to answer that.
Okay, so we can give them right. So one right, one wrong. 3 pass. First one, as you said, is
Plus
true.
5.
Yeah, we see hemorrhages all around the disc with systemic interferon alpha. Glands of Wolfering, they are located along the non-marginal border of both tarsal plates. With diabetic patients, after LASIK, persistent epithelial defect is the most common complication. And Iqbal Ahmad is the person who termed MITS. Lazoka study is the prevalence study on ocular complication of AIDS. So moving to the next team.
Team 4. Team 4, come on. Team 4, please come on. Team 4.
Acumen.
Acumen. Team 4 is Acumen. Come on, introduce yourself.
Good evening, sir. We're final year postgraduates from JIPMER Pondicherry. I'm Dr. Shruti and
I'm Fatima. Our mentor is Nirupama.
Okay, welcome. Congratulations and welcome.
Shall we start, sir?
Yeah, please.
Here goes the first question now. Meiosis is a potential ocular side effect of sildenafil. True or false?
Pass.
Second question. Site of greatest resistance to aqueous outflow is which part of trabecular meshwork?
juxtacanalicular.
Correct. US FDA and AO list LASIK in HIV positive patient as relative or absolute contraindication.
Pass.
Rainbow study is related to?
ROP. Pass.
Okay.
Ranibizumab.
Okay, you didn't say the ranibizumab?
ROP.
Okay, yes. Last question. Distance at which near worth for
Worth
the
for test perform?
35.
we can give, ma'am.
Yes, 33 is good. So meiosis is actually sildenafil is sympathomimetic, so it will cause dilatation. Greatest resistance, as you said correctly, juxtacanalicular. US FDA and AO both list LASIK in HIV patients as absolute contraindication. Rainbow study is about comparison of role of ranibizumab and laser therapy for ROP, and we perform near worth for test as 33 centimeter or 35 centimeter. We can take that. So total 2 correct.
3 correct.
3 correct. Sorry. Yeah.
Yes. So plus 30.
Plus 30. We are giving it for rainbow also, right?
Yes, ma'am. They said
right.
rainbow. Yeah. They said ranibizumab also and ROP also.
ROP also. Then yeah, perfect.
So team 5 is bacteria, boys.
Yes.
Team 5.
Again, boys team, sir.
Yeah, so I'm happy.
Yeah, let's see.
Hello.
Yeah, please.
Can you see us, sir?
Yeah, please.
Yeah, my name is Dr. Ashrat.
And I'm Dr. Nihit with final year residence from KMC Manipal. Our mentor is Dr. Shailaja.
Can you just come closer to the mic?
We can't
Because you're not audible, and so you will miss upon the points if the quiz master does not hear it adequately. And what?
Audible now, sir?
Yeah, better. So just explain about bacteria, boys. Yeah, this is something different. Bacteria, boys.
So the thing is, sir, during our quizzing prelims here, our mentor came up with this kind of quirky names for all the teams, and this kind of stuck with us. So every time we pair up, we just call ourselves bacteria boys.
So it's contagious, infective, or what else? Which type of a bacteria it is?
Don't really know, sir.
Okay, best of luck. Over to you, Mama.
Okay, sir. Let's see. So here comes the question for you. The first question is, bradycardia is a known side effect of prostaglandin analogs. True or false?
Pass.
For intracorneal ring segment, corneal pachymetry should be more than how many microns? Right. Third question. Severe vision impairment is vision worse than how much in better eye? Snellen's vision, how much?
Pass.
Fourth, Eagle study is related to?
Early lens extraction.
Great, that will give. We can give that. Chalazion is caused by inflammation and obstruction of?
Meibomian.
Great, 2 correct. So the answer here, bradycardia is not a side effect of prostaglandin analog. So this is false. For intracorneal ring and segment, to make the tunnel, at least 400 micron of thickness should be there. Severe vision impairment is less than 6/60 in the better eye. Eagle study, as you said, is early lens extraction in cases of primary angle closure glaucoma, and sebaceous or meibomian gland for chalazion, is inflammation and obstruction. So 2 correct answer, I guess.
Yeah. Well played.
Well played. Yeah.
6 IQ experts.
We are planning to check the IQ now. Are we? Or this is IQ lens, Alcon.
Your team 6, please.
Doctor, it should be team 2, right? Their audio is fixed.
Okay, fixed. Okay, then we can take them.
Okay, team 2, please come back. Yeah,
Sir,
just
am I
introduce
audible,
yourself. Yeah.
Good evening. I'm Dr. Saujanya, and with me is Dr. Simran from Rangarai Medical College, Kakinada, sir. Our mentor is Dr. Rama Bharti.
Great, great.
Be a
Shall
bit
we start?
louder.
Okay, sir. Loud.
So here comes the question for you, team 2. The first question is, neomycin is the most common aminoglycoside to cause hypersensitivity reaction. True or false?
False.
Incorrect. Inner plexiform layer is composed of connection between bipolar, hemacrine, and which cell?
Horizontal.
False. Last muscle to be rendered akinetic with retropulbar block?
Pass.
Sorry. Okay.
Pass.
Who developed the technique of corneal cross-linking?
Pass.
Full form of MIBS?
Pass.
Okay.
Pass.
So 2 wrong answers we have.
Minus
Minus
10.
10. Yeah.
10.
So neomycin is the most common aminoglycoside to cause topical hypersensitivity, 6 to 18% cases actually. And inner plexiform, we all remember BAG, bipolar, hemacrine, and ganglion. That is how we remember. Last muscle, you give the block, you will realize superior oblique is the last muscle to go. And cross-linking, a German scientist, Eberhard Sporl, he developed it. MIBS is minimally invasive bleb surgery, also known as MIGS plus. So this concludes, and moving on to the next team, that is team 6.
Team 6.
Have they joined?
IQ experts, are you there with us? Team 6, I don't think we have them with us right now.
Okay. So
We can move on to team 7.
Team 7 DJ.
Hi, ma'am.
Hi, welcome.
I
Here
am
is something I have in my background, sir. Sorry.
Acha, DJ going on.
Yeah, here. Sorry. Please carry on.
Can you hear us, ma'am?
Yes, definitely. Please introduce yourself. Yeah.
Yeah, I am Dr. Devi from Devi, and my friend is Dr. Jose. We are
Okay,
from Cornell
DJ.
Medical College.
Okay, that's how
Our
DJ came.
mentor yes, ma'am. Our mentor is Dr. Gargi, madam.
Great, great.
Cheers,
Shall I
students.
start, sir? Yeah. Yeah. So here comes the question for you, team 7, DJ. The first question is, in nanophthalmia, eye is smaller than normal with a disproportionately large lens, but it is otherwise normal. True or false?
True.
Correct. Outer plexiform layer is composed of photoreceptor cells, bipolar cells, and which other cells?
False.
Third question. When is the World Braille Day?
March 4.
Clear study is related to?
False.
Fifth question is, lowest risk of corneal or conjunctival toxicity as preoperative antiseptic is?
Pass.
Okay. Sorry, I couldn't hear this.
They said pass.
Okay, for World Braille Day, they had said March or something.
Yes,
Yeah,
they
March.
said March 4th. It's wrong.
It's January 4th, actually. Yeah. So in anophthalmia, it's just the eye is smaller and lens is proportionately larger. I mean, in comparison to eye, this is normal, but otherwise it is not disorganized. And again, for outer plexiform layer, we remember it as BPH, bipolar, photoreceptor, and horizontal. World Braille Day, Jan 4th. Clear. This study has been conducted in Aravind Eye Hospital by Prasanna and group for fungal keratitis. This is cross-linking for infection reduction. And lowest risk, as we all use, povidone iodine 5%. Yeah.
One correct and one wrong, so +5.
Yes, ma'am. Yeah.
So now
So
team
this team, okay, we'll shift to team 8.
No, no, ma'am, you were saying something.
Done now?
Yes, yes.
Yeah.
So team 8, brave believers.
I believe they are here.
Yeah, please go ahead.
Good
Yeah,
evening, ma'am. Am I audible?
yes, go ahead.
I'm Dr. Divyanjali. He is Dr. Rakesh. We are from GMC Bhopal. We are second year resident.
Okay, team brave believer, just a question for you. Hello, can you hear us? Hello.
You're using two devices, doctor.
Huh?
By using two devices.
One device only, please. Can you hear us?
Yes, sir.
Just a question for you, non-academic question. You have labeled your team as brave believers. So we need to believe
Yes,
you're physically brave or mentally brave.
Sir, we are both physically and mentally brave.
Okay,
So you want us to come there and challenge? Sir.
I was a bit afraid at my age with that young man, young hunk over there. He's physically challenging me. I will give him the easiest of the question.
Okay, here it goes then.
Upon it.
Okay, here comes the first question for you. Hard exudate are seen in inner plexiform layer. True or false?
False. False.
Correct. Initial target pressure for severe glaucoma damage. How much percent is below the baseline?
Pass. Pass.
Third question. Salisbury macrodystrophy results from mutation in which? Okay, fourth. Only FDA approved topical agent for reversal of pharmacological dilatation. Fifth. Ophthalmic artery enters the orbit, just dash to the optic nerve. You need to tell the relation.
Pass.
Okay. So we have one correct answer. It is hard exudate in outer plexiform, not inner plexiform. And initial target pressure should be decreased by 30% in cases of severe glaucoma. Salisbury macular dystrophy is because of TEMP3. The only FDA approved topical agent for reversal of pharmacological dilatation is phentolamine 0.75%, got approval in September 2023. And ophthalmic artery enters the orbit just inferior to the optic nerve. That is how it is. So with this, we have come to the end of rapid fire first. And the next quiz master that we have with us is Dr. Arvind Kumar Maurya. He's additional professor at AIIMS BV Nagar, and he has multiple awards to his credit. I mean, he doesn't need this long introduction. We all know him. He's the first Indian to win Ophthalmic Star Award at Amsterdam ESCRS 2021. He has received AIS International Hero Award in the year 2021, 22, 23, 24, and hopefully the next one also. First to receive AIOS Senior Academic Achiever Award 2021. So you know whom you are going to face next. And he has got multiple best video, best free paper awards. He has more than 500 international and national presentation, more than 100 publication. So the list is on and on. So I'm just going to hand it over to you, sir. So welcome, sir. Arvind, sir, over to you.
Thank God, Dr. Mamta. Otherwise, I thought you would exhaust the whole time of quiz.
No, I'm smart. ऐसे नहीं choose किया है.
Come, younger brother.
So thank you, Dr. Mamta, for such a nice introduction. And thanks for the opportunity, Dr. Prashant, Dr. Shilpi, and special thanks to my fellow Dr. Irti Sahiti Saho for helping me in framing the questions. So we will start, and all the best, all the 20 teams. Congratulations. You all are winners. You all are champs. All the very best. Next slide, please.
Team 9, Golden Gazes.
Right. So team 9, kindly introduce yourself.
Get your video on, team 9. Golden gazes. Team 9, golden gaze. Shilpi, are we missing them?
They were there.
I think they are logged out or what? I don't see them. Let's move on to the next team then.
Team 10.
Iconic. Team Iconic. Yeah.
Good evening, sir.
Yeah. Introduce yourself.
Sir, I'm Dr. Ashwati and my partner is Dr. Abarna. We are from Kottayam Medical College and our mentor is Dr. Padmasri.
Okay. Welcome, Dr. Team Iconic. And over to you, Professor Arvind.
Yeah. So 30-second time. Next slide, please. So Schwalbe's line is thinned in Axenfeld anomaly. True or false?
Pass, sir.
Next, expand STSG.
Pass, sir.
Oral dose of vitamin A in less than 1 year of age.
1 lakh international image.
True. T sign is seen in B scan in
Posterior scleritis.
True. Eddy-tonic pupil is due to inflammation of
Ciliary ganglion.
Good.
First one is true, sir.
What?
First one is true.
First
Shall
one.
we take the answer, sir?
Yeah, they answered within their 30 seconds. They have the right to go back.
Okay.
So
And that is the wrong answer. So they get -5 for that.
Okay.
That's why I was not keen.
Yes, I was even not keen to get that. Okay.
So Schwalbe's line, it is false. It is thickened. And STSG is split thickness skin graft. 1 lakh interlacian unit. You are absolutely right. Posterior scleritis and panophthalmitis, T sign, and eddy-tonic pupil is ciliary ganglion. So
Plus 25 for them.
yeah.
So next team.
Yeah, next team.
Team 11, self-help.
Sorry, which name?
Self-help.
Self-help. Okay.
Good evening, sir.
Yeah.
Good evening, sir.
Please introduce yourself.
Sir, I am Dr. Shomi from Vimsar, sir, and my partner is Dr. Ranjita, and our mentor is Dr. Shashmita Shahu, ma'am.
Which place you said you are from?
Vimsar Bulla, sir. Orissa.
Okay, very well. Welcome. So what does self-help mean?
Sir, we are independent girls, sir.
Okay. Great. Why should boys only have fun? Arvind Maurya, that is what they mean. Okay. Over to you, self-help.
I have more number of girls fellows. So your time starts now. Yes. Alpert syndrome has posterior lenticular.
False.
Expand YAG and NDYAG.
Yttrium, allium, garnet. Yttrium, atrium, garnet.
Type of ptosis due to superior rectus weakness.
Superior rectus weakness. Sir, pass, sir.
Angioid streaks are seen in which layer
Pass,
of
sir,
angioid?
pass.
And synonym for pattern recognition of cylindroma, a type of sweat gland tumor?
Pass, sir.
Okay. So how many they have answered, Shilpi?
Sir, actually first was wrong. Second, they said instead of aluminium, they said something else.
Okay, give them the marks. Okay, no problem.
Yes. So +5.
Yeah. So type of ptosis because of superior rectus weakness is the unusual type of congenital ptosis. The angioid streaks, they are seen in the Brooks membrane. And the synonym for pattern recognition of cylindroma, that is a Ant mini, also known as turban tumor, because of the location and the visual appearance. So next team.
Team 12, Janan.
Yeah, come on, introduce yourself.
Good evening, sir.
Again, your two devices are on.
Good evening, sir.
There is a echo.
Good evening, sir.
Yeah, please go ahead.
I am Dr. Jayashree and my partner is Dr. Nancy. We are from RIO Chennai. Our mentor is Dr. Hemapriya, ma'am.
Okay, welcome to the team. Yeah, okay, over to you, Arvind.
Yeah. So your time starts now, 30 seconds. Yeah, next slide, please.
I think there is a lot of disturbance at your end. You need to sort it out, otherwise you will miss upon the questions.
Okay, sir.
Still, there is a confusion.
Kindly mute one of your device.
Sir, we actually log in from one device only, sir.
Okay, go ahead. Let's see.
Yeah. Next slide, please. So heterochromia iridis is the two iridis of different color, true or false?
True.
Next. Expand LASIK. Very simple.
Laser assisted. Laser assisted. In situ keratomyelitis. Next question, sir.
Denial of blindness is known as
Anton syndrome. Anton syndrome.
CMV
Next,
retinitis.
pass.
Okay, so time is up.
Next.
50, sir.
McCoy triasquare. Okay, next slide, please.
So they have attempted 5 questions.
Yeah.
Four,
Shilpi. Fifth they didn't.
McCoy triasquare Paget instrument is used to measure.
I think they have exhausted their time, Dr. Arvind.
Yeah, that's why I stopped. So heterochromia iridis is the different color in the same eye. LASIK, okay, we can give you marks. Denial of blindness is known as visual anosognosia, and CMV retinitis is 50 cells per millimeter cube. And McCoy tri-square Paget instrument is used to measure the globe tosses, right?
Okay.
So how many marks, Dr. Shilpi?
2 correct, 2 wrong. So it is plus 10.
Okay. Next team.
Yeah. So now it's time for the break.
Sure.
It's a commercial. 2 minutes. So thank you, Small Microlabs, for all the support you have been with us. Okay, now let's move on to the next round.
So no, it is now time to declare the last episode's private practitioner winners.
Yeah, please go ahead. So the private practitioner category, these are the 3 winners. They can log in at the conclusion of this rounds, all the rounds on the Zoom platform. There we will interact with them. So it was 94465823337, 94011672009, and 90610311036. So all are requested to please join us, log in on the Zoom platform at the conclusion of this today's round, episode 4. We will be interacting with you. These are the quarterfinal 3 winners in the private practitioner category. Thank you.
So with this, we move on to the second section of MCQs by Dr. Mamta Singh ma'am.
Thank you again, Shilpi. So we'll start with the MCQ. And here goes the first question for you. What is phaco-starch? Option A is restoring accommodation by replacing the presbyopic crystalline lens by a flexible polymer gel in the lens capsule. Option B is restoring vision by doing phaco with accommodating IOL. Option C is restoring accommodation by replacing the presbyopic crystalline lens with an EDOF lens or extended depth of focus lens. And option D is anything related to refractive lens exchange. And your time starts now. The correct answer for this question is actually option A, which is restoring accommodation by replacing the presbyopic crystalline lens by a flexible polymer gel in the lens capsule. It is actually a very old technique, first described in 1986 actually, and we perform the normal cataract surgery. We take out the cataractus lens, we leave the capsule, then we inject some, optically clear biocompatible substance, and then we give the by certain wavelength of, we give it there, and then the power is given. That is how the accommodation is maintained, because we are maintaining the zonule there. And that is phaco-SRs for you. Moving on to the next question. True about megalocornea is all except. You have to find out which one is not a part. Option A is X-linked recessive disorder. Option B is progressive, bilateral, and symmetrical. Option C is it is seen in more than 90% of the cases are seen in male. And option D, in these cases, corneal thickness is normal, curvature is normal, and normal endothelial density. Which of these is the answer here? Your time starts now. Time's up. The correct answer here is option B. Megalocornea is a non-progressive disorder. It doesn't progress. It is congenital. Otherwise, it is bilaterally symmetrical, X-linked recessive, 90% of the cases seen in male, and all other options are normal. So moving on to the next question. This is a clinical picture. We can see it here on the left side. It is of a 65-year-old male who developed the situation following a trauma. Visual acuity is no PL, and he was given a cosmetic contact lens. We want to know what is the most probable pathogenic mechanism, or what is the etiopathogenesis here. And your options are option A, cytokine storm. Option B is neutrophil infiltration. Option C is breakdown of blood-retinal barrier. And option D is genetic predisposition. And your time starts now. Time's up. And here the correct answer is option C, which is breakdown of blood-retinal barrier. What we can see here is a case of phthisis bulbi, and it happens only when the growth factors are released once the blood-retinal barrier is gone. And these growth factors, they are responsible for the heterotrophic changes which occur in these cases. So the correct answer is the breakdown of blood-retinal barrier. Moving on to the next question. Which is not a selective E-prostanoid subtype 2 agonist or EP2 agonist? Options are option A, taprinipag isopropyl. Option B is prasinipag isopropyl. Option C is raganipag isopropyl. And option D is omidinipag isopropyl. And your time starts now. Time over. And the correct option here is prasinipag isopropyl. All others are EP2 agonists. In fact, option D, omidinipag, is actually FDA approved EP2 agonist. Prasinipag is no such medication is there. We have just taken the name of Prashant Bavankule, the first part, and added the NAPAG. That is how the things are. So moving on to the next question. The last question for this round is, which of the following is not a bleb grading system? Option A is the Indiana bleb appearance grading system, that is IBAGS. Option B is Moorfield bleb grading system, or MBGS. Option C is Wurzburg bleb classification score, or WBCS. And option D is American Academy of Bleb Grading System, or AABGS. Your time starts now. Time's up. The correct answer here is option D, which is American Academy of Bleb Grading System. Bleb grading, we consider different factors like bleb vascularity, the vertical height, horizontal dimension, etc. IBAG is the most commonly used grading scale. Otherwise, Moorfield is also very commonly used. Wurzburg is another system, but there is no grading scale or grading system as American Academy of Bleb Grading System. So that is the answer here. With this, we'll move on to the next round by Dr. Himadri Chaudhary. Welcome, Dr. Himadri Chaudhary.
Thank you, ma'am. Those were really interesting questions.
Thank you so much. Yeah.
Okay,
So,
so
sir,
we'll
start
move
with
on
the
to
rapid
the...
fire round. Yeah.
Yes.
Team 13, Srihar.
Yes, ma'am.
Yes,
Yeah, please introduce yourselves.
I'm Dr. Rohan, and this is Dr. Simran from Sri Ramachandra Medical College, Chennai. And our mentor is Dr. Gayatri J. Panikar, pediatric ophthalmologist.
Okay. Best of luck to you for your rapid fire.
Thank you, sir.
So let's start.
Yes.
Okay.
Serpiginous-like choroiditis may be associated with infectious etiology. True or false?
True.
Next. Kratschmer spots are seen in which layer of cornea?
Pass.
Range of keratometry reading that a keratometer can take in diopters.
34 to 52.
RAF rule is used to test dash the patient.
Pass.
Okay, name the implant.
Aniridia implant.
Okay, we'll give it to them. Great job. So serpiginous choroiditis, that is true. It may be associated with infectious etiology. Kratschmer spots, which are indicative of rejection, is seen in epithelium and anterior stroma. And can we give it to them? 36 to 52. They said something very close.
Yes, sir. Yes, sir.
Okay. RAF rule is used to test convergence and accommodation, and this is an iridia ring segment or a mocha implant. So
plus 30.
3 correct. Plus
Yes.
30. Great
Plus
job. Great job.
Thank
Well played.
Thank you.
The next team is team 14, that is Dr. Bimalesh Ojha.
Okay, please introduce yourselves, Dr.
Good evening.
Bimalesh.
Good evening, sir. Myself, Dr. Bimlesh Ojha from Gandhi Medical College, Bhopal. Sir, my co-colleague is separate place, so I want to attend. My mentor is Dr. Aditi Dubey, ma'am.
Okay, best of luck. Best of luck.
Thank you, sir.
We'll move on to the next slide. Yes. Negative dysphotopsia does not occur in ACIL. True or false?
Sir, pass.
Next question. Percentage of endothelial cell loss after DSEC?
Sir, pass.
What gene is the cause of Leber's congenital amaurosis and now used for gene therapy treatment?
Sir, RP gene.
Spontaneously,
RP65.
yes, correct. Spontaneously regressed retinoblastoma is also called?
Sir, pass.
Okay. So you'll probably not get the last question because you have exhausted your time.
Answer, but you will not get the marks.
Okay. What is the near and far distance at which this test can be done? You can identify what this is, right?
Region bar test, sir. Sorry, distance.
Yes. Yeah, near and far, at what distance it is done, the tests?
Sir, far 6 meter, near 33 centimeter.
Correct. Great. Just you ran out of time, but yeah, so RP65 is correct. Negative dysphotopsia occurs only in PCILs, not in ACILs. 30 to 40% cell loss after a DSEC. LCA, you answered correctly. That is the drug name is Luxturna, that is used for gene therapy. Retinocytoma is the correct answer for retinoblastoma that has regressed spontaneously. So plus 10, right?
Yes, sir. Plus 10.
Thank you, sir.
Okay, well played.
Next team, team 15, PG9871605473VB.
Okay, what is that?
Vidit Bansal and Zakir Hussain.
Great.
Chalo, introduce yourself, bhai.
That is your...
Not sure.
Yeah, please go ahead.
I'm Dr. Vidit Bansal in RPC, final semester.
I'm Dr. Zakir Hussain, third year, RP Center.
And our guide is Dr. Namrata Sharma.
Oh, great. Best of luck to you.
Thank you.
Thank you.
Is,
Easy
she's
questions for
watching
you.
you or not from Egypt? Is she watching you from?
I'm not sure, sir.
Okay, best of luck.
Thank you, sir.
Time starts now. Acanthamoeba does not depend on human host for completion of its life cycle. True or false?
True.
Okay. Critical angle of
46
air
degrees.
cornea interface. 48. Enzyme responsible for cataract in diabetic patient.
Aldol. Pass.
Okay. During keratometry. Correct. Next. Identify the systemic syndrome which is
VHS.
Sorry?
BHL.
Correct. Great
Yes,
answers. Wow.
all the correct
Amazing
answers.
job. Amazing job. We can give the Eldos reductives as well.
Yes.
Yeah. Great. Great
Okay.
job. Great job.
Thank you.
Congratulations. I think you are amongst the first team to have all perfect 50.
All 5 correct. Yes.
All the quarterfinals till now.
Till now, this is the fourth quarterfinal. So the first team to score perfect 50. That's great. Congratulations.
Thank you, sir.
Thank you, sir.
No pressure of the mentor.
No, ma'am. No pressure.
Okay, chalo. Let's move on to the next team. That is team 16, Sunshine.
Please introduce yourselves, Team Sunshine.
Hello, good evening, sir. I'm Dr. Charu from Thendai Hospital. And I'm Dr. Spurti from Thendai Hospital. I'm a second year resident, and our mentor is Dr. Sangeet Mittal.
Great. He's an amazing surgeon.
He's a dear friend of mine, more importantly. But what do you mean by sunshine here? हम तो जब भी वहाँ पे आते हैं.
Always radiating, sir.
Pardon?
So spreading radiation, positive energy.
Always positive.
Okay.
Yes, sir.
Then because whenever I come in Jalandhar, I hardly see a sunshine. It's always so
Sir, आप हमेशा
cold and-
winter में जाओगे तो क्या करेंगे?
It is sunny now. Yes, sir. You should visit now, sir. It's very sunny here.
Okay. Go ahead.
Right.
Let's start.
We'll move on to the questions. Yeah. Your time starts now. Abnormal optokinetic nystagmus responses can occur with occipital lobe lesion. Okay. Mode of inheritance of Axenfeld Rieger syndrome.
Dominant edge. Pass.
Normal values of near point of convergence.
8 to 10 centimeters.
During keratometer calculations, refractive index of cornea is multiplied by. Okay. Rare pupillary complication after keratoplasty. What can you see over here? Name it.
Traumatic midrias. Midrias. Passer or Axenfeld Rieger, we want to say it's like autosomal dominant.
Oh, it's
Okay.
pupillary complication post-op, post-PK.
No, they're talking about Axenfeld Rieger syndrome. That's autosomal
The
dominant.
second question. The second
question.
Okay.
Midrias. So sphincter damage leading to midrias.
Okay, let's.
So I'm looking for a
answer.
specific answer. Yeah. So your first answer is correct. Autosomal dominant is correct. NPC is also correct. So 3 for them. 3 correct answers, right?
Plus 30.
Plus 30. Good job. Great work.
Thank you.
Now team 17, GMC Focus Squad.
Please
Good
introduce
evening, sir.
yourselves.
Good evening, sir.
Yeah, go ahead. Introduce.
I'm Dr. Shivani, sir. I'm Dr. Pravalika, sir. And we are from Guntur Medical College, and our mentor is Dr. Ravi Babu, sir.
Okay.
Okay. Best
Do
of
you,
luck.
you are always focused on studies or even beyond? What do you intend to say?
Everything, sir.
Okay, we take it.
All right. Your time starts now. Uveal scleral outflow is pressure insensitive. True or false?
Pass.
Inferior oblique overaction commonly causes dash pattern strabismus.
V pattern.
Yes. Prism bar cover test measures dash deviation.
Pass.
Following chemical injury, which factor is the most important predictor of progression of limbal stem cell deficiency?
Limbal ischemia.
Okay, just listen to the final question. What stage of FFA is this?
Pass.
Okay. So you got
Plus 20.
B pattern right?
So 2 questions, right?
Limbal ischemia also, sir.
Ischemia as well. Okay. Chala manchi. Great.
Okay. So now moving on to the next team, that is team 18.
Team Nimi.
Nimi, please introduce yourselves.
Good evening, sir. Myself, Dr. Vaishnavi.
I'm second year resident, and my partner is Dr. Rutuja. She's third year resident. She is not able to attend today because of her postings. And we are from YMT Ayurvedic Medical College, Khargar, and our mentor is Dr. Adarsh Sharma.
Okay, okay. Best of luck to you.
Thank you, sir.
The time starts now. Congo red stain is used in granular dystrophy of cornea, true or
Pass.
false?
Pass.
Most common organism responsible for late onset endophthalmitis after cataract surgery?
Pass, sir.
According to Goldman equation, what is the ratio of increase in intraocular pressure to the increase in episcleral venous
Pass,
pressure?
sir. Pass, pass.
Lesion of the optic radiation involving Meyer's loop causes which defect on perimetry?
Pass, sir.
Okay, and what is this sign on B scan?
Sir, swaying seawood sign.
No,
Seaweed.
but they answered after this thing, right? So probably no negative marking.
Nothing. Yeah.
Okay, okay, okay.
Okay.
So Congo red is not used. This is false. Congo red stains amyloid. Granular dystrophy is Mason trichrome. Most common organism for late onset is Propionibacterium acnes. The ratio is 1:1. They are directly proportional. Meyer's loop lesion causes superior quadrantanopia, and the B scan is a inverted T sign. As we just heard a little bit while ago, that happens in posterior scleritis.
Right.
All right.
Okay.
So with this, we move on to Arvind sir for the next sets of rapid fire round.
So which is the team, Dr. Shilpi?
Team 19, Hufflepuff.
Puff.
Very unique name.
Yeah.
Yes.
Are they puffing just before interacting with Dr. Arvind Maurya?
Dr. Alka, Dr. Bisma.
Hello,
Yeah, come on, introduce yourself.
am I audible?
Yes.
I'm Dr. Bisma and this is Dr. Alka, and our mentor is Dr. Avinash Ingore,
Which place you are from?
KM Mumbai.
KM Mumbai.
Jaya-
Okay. Chalo, Jai Maharashtra.
Jayatri. Yes,
Welcome.
sir.
Okay, all the very best.
Thank you, sir.
So let's start,
So,
sir.
yeah.
Okay.
So first question, rho kinase inhibitors increases outflow capacity of trabecular channels, true or false?
True.
Expand GDI.
Glaucoma drainage.
Uthoff phenomena is seen in which condition?
Multiple sclerosis.
Good. Before initiating eyelid reconstruction after the malignant tumor removal, which test to be done?
Pass.
Hollenhorst plaques are seen in which systemic condition?
Pass.
Okay.
Plus
So
30.
how many right, Dr. Shilpi?
Plus 30. 3 right.
Okay. So rho kinase inhibitors, they act by increasing the outflow capacity. Yes. And GDI, glaucoma drainage implant, Uthoff seen in multiple sclerosis. And before initiating eyelid reconstruction, frozen section analysis of all the tumor-free eyelid margins is a must. And Hollenhorst plaques, they are seen in hypercholesterolemia. Next.
Yes. So next, 20, Weekend Warriors. Weekend Warriors.
Yeah, come on,
It's
introduce.
early weekend.
Yeah.
Sir, midweek.
Good evening, sir.
Yeah, please go.
Please introduce yourself.
I'm Dr. Deepthi from Netradama Eye Hospital.
And I'm Dr. Shivi, Netradama Eye Hospital.
Our mentor is Dr. Manisha.
Okay. So what does Weekend Warriors means? Belonging to a Bangalore city, you mean evenings and all? It's a city for all the pubs and all. That's why Weekend Warriors. What do you think, Arvind?
Means, after enjoying and fun, they are still standing.
Okay,
They are
great.
warriors.
What I think is, sir, everyone else will be enjoying and they too are taking care of everything else. So Weekend Warriors.
Yeah, absolutely. I
Right?
agree with you, Dr. Shilpi.
We also agree.
Best of luck. Go ahead.
So your time starts now. First question, please. Pleasure ring is seen in Wilson's disease. True or false?
False.
Expand PEE.
Punctate epithelial erosion.
Which stent is used to treat canalicular laceration when upper and lower canaliculi enter the sac independently?
Mini Monaca. Mini Monaca.
Most surgeons are mainly which specialist?
Oculoplasty. Plastic surgery.
No. Sign on X-ray and floor of the orbital fracture?
Teardrop sign.
Okay.
Most surgeon, basal cell carcinoma, sir. Dermatologist.
3 correct,
Pleasure
2
ring is
wrong, plus
so it
20.
is false. Yes, you want to say yes, you can go ahead.
No, we told
It's a-
actually plastic surgery. Dermatologist will be more correct.
You want to defer?
No, sir.
No, sir.
Right? So Fleischer ring is seen in keratoconus, not in Wilson. KF ring is seen and punctate epithelial erosion. You were absolutely right. And a stent is Crawford stent when they are opening in the sac independently. That is used. And most surgeons are mainly dermatologists. And sign on X-ray, it is a teardrop sign. So how many marks, Dr. Shilpi?
Plus 20. 2 wrong, 3 correct.
Okay, okay.
Well played.
So the 2 remaining teams, team 6, IQ experts, and team 9, golden gazes. Are you there?
Golden gazes,
ma'am.
I can see now on the screen.
Yes, ma'am.
They are ready.
Yes, sir.
So we can play with them.
Yeah. Can you get your video on, golden gazes?
Sir, it's on already.
Okay, fine. Introduce yourself. We can't see you, but be it.
Hello, I'm Dr. Lokesh from RKDF Medical College.
Can you speak a little bit louder?
Yeah.
I'm Dr. Lokesh from RKDF Medical College, and
Dr. Vartika from RKDF Medical College, Bhopal.
mentor is Dr. Vasudha ma'am.
Okay. Welcome. Over to you, Arvind.
Yeah, all the best. So first question. Pilocarpine is a drug of choice for malignant glaucoma, true or false?
False.
Expand PRK.
Different. Pass.
Next, zygomaticomaxillary complex fracture is known as?
Pass.
Simplest of which radionucleotide is used in dacryocystography?
Gadolinium.
Next, slit of beam is projected on the fovea and macular hole. The test known as?
Pass.
And the answers are pilocarpine is not the drug of choice. The PRK, simplest of all, photorefractive keratectomy. Zygomatico complex fracture is known as, again, very simple tripod fracture. And the nucleotide is technetium 99. And the slit of beam is known as Wadsky-Allen test. How many marks, Dr. Shilpi?
Plus 5.
Okay. Do we have the last team? Team
Yeah.
6?
IQ experts? No,
I
sir.
think, no, we are not having them. I think.
Okay. Okay.
So, we'll move on to the last set of MCQs by you only. Just
Right. Next slide, please.
yes, I'm sharing the screen.
No problem. Take your time.
Is it visible?
Yeah.
Okay.
So which is not done for physical examination of the orbit? A, proptosis. Periocular changes. C, pulsation. Or D, percussion. And your time starts now. Yes, next. Show them the answer. So the answer is percussion. So there are 7 P's when we are doing the physical examination of the orbit. Pain, progression, then proptosis, pulsation we need to see, periocular changes. Right, so all these 7 P's are there, but not percussion. Right? Next MCQ. So this is a newer technique. So in modified flying baby positioning, all is done except the baby is wrapped in a cold cloth. B, a sterile speculum inserted after topical anesthesia. C, one arm of technician supports the chest and the chin of the baby and the other hand supports the head. Or D, pupils are aligned by moving the head with the movement of the eye guided by visual feedback on the monitor. And your time starts now. Very simple. Yes, common sense. So the correct answer is the baby not to be wrapped in a cold cloth, otherwise in a warmer. The baby must be comfortable. Next MCQ, please. So which types of hemorrhages are seen? A, dot and blot, B, smokestack, or C, popcorn and hot dog, or D, none. And your time starts now. Very simple. See the images carefully. And the answer is popcorn and the hot dog, as seen in the images. They are as equivalent to the popcorn and hot dog, right? The lower image. Sorry?
So let's move on to the next question.
Yeah. So all our studies in ROP except beat ROP, B, rainbow, C, ETROP, or is it D, RTROP? And your time starts now. And the answer is RTROP. Beat ROP is on bevacizumab, rainbow is on ranibizumab, and the ETROP is the early treatment ROP. So RTROP, there is no such study. This is the answer. And the last question is very simple. All is true regarding this image except, so see the image very closely. A, microperimetry color fundus and fundus autofluorescence with large soft drusen and pigment abnormalities. B, microperimetry color fundus and fundus autofluorescence with large hard drusen and pigment abnormalities. Or C, decrease in sensitivity, relative scotoma in yellow dots, green are normal, and red dense scotoma. Or is it D, increased autofluorescence corresponds to drusen and pigmentation? Your time starts now. So the wrong answer is the hard drusens. These are the soft drusens. So all the 5 questions, they are over?
Yes, sir.
Yeah, okay.
So I think, Shilpi, are we at the conclusion of the thing?
Yes, yes.
Okay. So can we request all the prize winners of the last episode to join us on the Zoom platform? Any mentors have logged in? Can we, mentors, please get your video on. We would like to appreciate your presence.
So Dr. Gayatri,
Yeah,
Dr. Shailaja Bhatt, ma'am.
Dr. Gayatri ma'am, Dr. Shailaja Bhatt,
Dr. Siddharth Narendran.
are requested to join us live on this Zoom platform. We would love to acknowledge your presence as well as thank you for being with us and congratulate you for your team's performance as well. Please. Dr. Shailaja ma'am. Yes, good evening ma'am. How are you?
Yeah.
You are muted.
I'm good, sir.
Thank you. Thank you for being with your team. Your team did well and it is doing well as well. Naturally, if you have a mentors who are themselves a quiz masters, I think they.
Thank
Great. So she's again a VR surgeon, Dr. Arvind. Dr. Shailja is a very famous quiz master from down south from Karnataka.
Thank you, sir. Thank you.
Welcome. Thank you. Thank you for their being with us. Dr. Gayatri ma'am, how are you?
Hello, sir. Good evening, sir. I'm good, sir.
Thank you. Thank you for being your team.
Thank you, sir.
I thank you for being with us. Siddharth.
So, so we
Hello,
forgot
sir.
to introduce
Hello.
our mentor, Siddharth sir. Siddharth Narendran sir is our mentor. We forgot to introduce him when we introduced him.
You Siddharth needs no introduction for your information, Chinmay as well. Huh? Siddharth
Yes, sir,
is
definitely.
Siddharth is a rising star in the field of vitreoretina, and we are so proud to have him in our retina with multiple awards already in his kitty at such a young age.
Thank you. Thank you.
Hmm?
Thank you. Thank you, sir.
So I think Chinmay, where did you? I'm losing you. Chinmay, where are you?
Yes, sir.
When you have a mentors like this, it always rubs on the students, I believe. Hmm?
Definitely.
So we would
Yes,
be
sir.
loving to see you both in a short while having few of these awards which he is having in his kitty. What
Let's
say?
hope so, sir. That's
Hmm?
He's our idol, sir.
Yeah, good. Thank you, Siddharth, for being with us.
Thank you very much, sir. Thank you.
So how did you find the quiz part of it?
Excellent, sir. Excellent.
Hmm?
Very
Okay.
impressed by all the participants also.
Yeah. We are happy to have mentors like you, and we are very proud of younger mentors like you who are guiding the teams to the quarterfinals and semifinals, So
Thank
best
you.
of luck. Do follow us. Okay.
Thank you.
Any other people, Shilpi? Yeah, Dr. Tanmay. Dr. Tanmay is there with us.
Sir.
Can you unmute yourself, sir? You're a
Yes,
mentor.
sir. Good evening, sir.
Yeah. You're mentoring the team.
No, sir, I'm not mentoring. I'm actually in second position in the previous.
Yeah. Correct. Okay, welcome. So congratulations. Where are you from? Please do introduce yourself.
Sir, I'm in Army, sir. I'm serving in Military Hospital, Wellington, sir.
Wellington, Chennai.
It's in Tamil Nadu, sir, near Ooty, sir.
Near Ooty. Okay,
Yes.
what's your subspecialty and what keeps you inspiring to participate in spite of your such a rigorous schedule in the army? How do you find time for all this quizzing and all?
Sir, this is a relatively low load place, sir. So I get time here, sir. And I'm doing this big Q quiz since my residency time, sir. So I don't miss it actually. I like it so much, sir.
Thank you, Dr.
And
Tanmay.
it is very interesting. All the questions are very interesting, and like today's questions are the rapid fire round is very difficult, sir. It was really new questions, sir.
I think I should blame it on Professor Arvind Maurya, who is heading the aims of Hyderabad. So when the teachers like them come, they are always supposed to be very harsh people, unlike people like me who have to practice are simple
I'm
and
willing to take the whole blame for my whole team.
I'm just pulling you, dear. So be it, Tanmay, thank you for being
Thank you,
with
sir.
us.
Thank you so
Good to
much.
see you, Tanmay.
And congratulations
Thank you, sir.
for
Thank you
being
so much.
the second prize winner for the last episode in the private practitioner category. And we are so happy to have you with us as a postgraduate and now into a private practitioner category. Congratulations and
Sure.
keep playing. Hmm?
Thank you, sir. Thank you so much.
Thank you. Dr. Gayatri?
Sir, I also took part as a postgraduate. We came third in the finals I think that was the COVID 2021.
First time, BQ, first episode of
Yes, sir. Yes, sir. From Jipma.
So where are you right now, Gayatri?
Right now I'm in Srihar, sir, Ramchandra Medical College in Chennai.
Okay, good. So what was your team? You have fielded any team from this time from
Yes,
Ramchandra?
sir. Yes, sir. Team Srihar.
Okay.
Srihar team.
Yeah.
Great. So nice
So
to
I was telling them that it was a really good experience. It helped us really prepare for PG, and it engages us in a different way. It's not boring to learn when you see it from a quiz aspect, and so I encourage them to go for it, and they also have a good time.
We are so happy
Great that you're continuing this.
We are so happy and proud. I should say, I feel so proud to see people graduating from the postgraduate category to the mentor and playing. seriously, it is a pat on our back for people like you who are
Yes, sir.
continuing
Amen.
following and graduating in various categories. Thank you. Thank you. We are so proud and so thankful to you for being part of our
Thank
this
you. Thank you
particular
for that.
process. Thank you, ma'am. Thank you. Any other people are there?
Anuja
Hmm?
Dr. Anuja, Dr. Pratik Prabhu.
Dr. Tanuja, Dr. Pratik Prabhu, can you get your video?
Anuja and Dr. Pratik Prabhu.
Yeah, can you hear us? Okay, I think anyone else, Shilpi?
No, sir.
Okay. So I think we had a good round, quarterfinals 4. And are we going to
Let me
declare
tell
the
you, sir, today is the most difficult time for us to, calculate basically, because many teams have performed very well
Okay.
in the quarterfinal 4.
And then we are being blamed for the tough questions. See?
Competition.
I mean, it's this AIMS people are otherwise also tough people. They are themselves brainy people, so they expect commoners like me also to
Sir, few minutes ago, you were like flaunting your vitro retina, guys. Okay, everyone is like, every good thing is about vitro retina, right? He's a good surgeon. He's doing this in vitro retina. He's getting prizes, awards in vitro retina.
See,
And
today, Mamta, there is a very skewed predominance of vitreoretinal surgeon, Shilpi, Himadri, and Dr. Prashant. And to some extent, Dr. Arvind doing a part of medical retina. So it is 4 versus 1, I believe.
sir, we call vitro retina guys as the orthopedician of ophthalmology.
Okay.
Okay. You need to have strong back muscle. You need to have strong neck muscle. And that is all.
Thank you, Beat. So, thank you.
Dr. Anuja has.
Yeah, Dr. Anuja.
Yeah, good evening. I'm Dr. Anuja from RIU Trivandrum.
Okay, thank you, Dr. Anuja. So last time you were the winner, huh?
Yes, sir.
Okay. So you are a faculty there or is a student there?
Faculty, I'm Associate Professor, RIU Trivandrum.
You look so small, so tiny. So I was having really a doubt whether you played in a PG category or a private practitioner category.
Private practitioner category. My daughter is also participating today, Team Acumen.
Okay, okay, okay. Oh, that's so nice. So
Hi.
mother, daughter duo.
Yeah.
That's great.
I think we should, in fact, all of us should clap for her. At her age, with a daughter participating and she's winning the prizes, I think kudos to you.
Thank you.
Okay, congratulations. Be with us. Do follow us in future as well. Thank you.
Thank you.
So I think it's time for us. We had a good quarterfinal 4. Are we going to, when are we going to share the results of the people who are going to make it into semifinals?
In 2-3 days.
Yeah.
Once
So,
the Kahoot scores are updated.
yeah. So by next 3 days, we will be sharing with you who are going to be the semifinals. So there will be about 40 teams into the semifinals.
20 teams.
20 teams into the semifinals, and there will be 2 semifinals. But mind you, all the people who made it to quarterfinals are equally competent, and they have already. I would rather say they are all finalists, and a big round of applause for all the teams who came into quarterfinals. So there were, in fact, when I look at the calculations of the previous 3 rounds, all teams are just a point here and there. So everyone is really working very hard and they are playing very hard. So it will be difficult for us rather, but yes, we will be going by whatever the results the Kahoot shows us with the added scores of the last few episodes, the best 5 performances of your preliminary rounds, and we'll be declaring in next 3 days. So keep your fingers crossed. We will be looking forward to meet all the semi-finalists in after 2 weeks on Wednesday at 8 p.m. again. It's my time and privilege once more to thank my dear brother Arvind Maurya, younger brother Himadri again, who and Dr. Mamta, who is like a younger sister to me. In fact, all these quiz masters are the backbone of our big Q because they really toil hard to make this particular event so popular, so attractive. And of course, my thanks also goes to Dr. Shilpi for being there with us and interacting. So a big round of applause for her. So it's time for us to say now bye-bye, everyone. So we will be meeting after 2 weeks on Wednesday at 8 p.m. for the semi-finals one. Bye-bye.
Okay,
Thank
good
you.
night, everyone.
Good night.
Good night.
Everyone.
Wonderful
Bye.
experience.
Bye. Bye.